some of the things I just talked about in terms of patient patient's ability to get through the treatments is number one important, because we know that if you don't complete your treatment, you're not going to do well. Then there's the whole issue of resistant disease. And there is a much larger percentage of patients with adverse biology in the young adult population compared to the pediatric population that require novel approaches. For BALL, as you were alluding to a few moments ago about the incorporation of novel antibodies into frontline treatment, that has become a very big focus of our clinical research studies in the young adult ALL population for patients with BALL. And it is clear that the antibodies are going to have a role in frontline treatment. Exactly how to structure that addition, and which drugs to use, when, for how long, remain to be determined and are the challenge for the next generation of trials. For TALL, we don't yet have these novel antibodies, and there are some very unique approaches that are being entertained and about to be tested in the frontline setting to further improve outcomes for these patients. And TALL is a disease of young adults, so the predominant population of patients with TALL are young adult patients. And so we really need, and they comprise about 30% of our young adult population. So while the antibodies are revolutionizing treatment of BALL and are easy to think about incorporating into frontline treatment, we don't yet have those kind of antibody or immunotherapeutic targeting approaches available for young adults. So with TALL, and so we're focusing on other agents, including the BH3 mimetics, that will sort of sensitize these cells to chemotherapy.